Welcome to another episode of Daily Dose by Dr. Karthika. So here we are dealing with Aphorism 3, which deals with the topic knowledges of physician. So what are the knowledges the physician must have to bring about a proper cure? One is knowledge of disease. That is, it indicates what is to be cured in a disease. Then knowledge of medicinal power, choice of remedy, proper dose and repetition, or knowledge of pharmacy. And also lastly but not the least, knowledge of obstacles to cure. Now each of these topics will be dealt with in detail. The first one, that is knowledge of disease. Now the physician should understand the true meaning of disease in every individual case. So what is a disease? It is a deviation from the normal functioning. Any deviation will come under the signs and symptoms of a disease. So that will include the mental features, the physical generals, and also any deviation from the normal functioning of any part, any organ, tissue or system. So all the signs and symptoms will definitely come under the disease. Now, knowledge of disease does not just mean diagnosing the case, because only if a physician understands what is the theory of vital force and how the vital force get deranged by a dynamic influence, only then he can identify all the true signs and symptoms of a disease and hence bring about cure by individualizing the case. Only if individualization is done, then we can find out a simillimum for that particular case. Now, diagnosis is also important in a case. Why? Because only if we diagnose the patient, then we will be able to clearly differentiate between common and uncommon symptoms. And the uncommon symptoms help us in individualizing the case. And also with diagnosis or the knowledge of pathophysiology, we will be able to understand the scope of cure in that particular case. That is, if the case is curable or incurable. If it is incurable, then only palliation can be done in that particular case. The physician should have a knowledge of medicine. That means he should understand what are the curative powers of every drug. Now, the physician should also have an idea about the source of the medicine, the action of medicine, the method of preparation, and also the ways of administering the medicine. Now, only if the physician have a right knowledge of the medicine or the signs and symptoms of the every single medicine, that is simply the knowledge of Metra Medica, he will be able to practice. So, along with the clear understanding of Metra Medica, he should also understand the dynamic power of medicine. That is how drug proving works. Drug proving is simply deranging the vital force of a normal, healthy human and producing signs and symptoms. So, only if he has an understanding of Metra Medica as well as that of drug proving, he will have a complete knowledge of medicine and practice successfully. Now, the third point is choice of remedy or selection of remedy. Now, the physician must know how to adapt. That means he has a theoretical knowledge about the concepts of homeopathy. All the cardinal principles all he has theoretically understood. So now he has to apply this theoretical knowledge to every individual case. This is how he adapts according to every single case. Now he knows how to construct a totality, how to form a portrait of disease, and application of this portrait of disease to Metra Medica, and then selection of right medicine comes only if the physician knows how to adapt according to each individual case. Now, if he has understood what is the curative power of a medicine and also identified what is to be cured in a patient, only then he can bring about recovery by selecting a simillimum. The fourth one is knowledge of pharmacy, that is proper repetition and proper selection of dose. So, first one, knowledge of dose. The physician must understand how much of a dose is required in each particular patient to arouse his vitality. So, to select a dose, the physician must have knowledge about the various scales and series of power in each scale. That is the knowledge about centesimal scale, knowledge about decimal scales, and also the series of powers in each scale. For example, in decimal 1x, 2x, 3x, and in centesimal it starts from, commonly we practice with 30C, 200C, then 1M, 50M. Like that. So, the physician should have a knowledge about different scales and also the series of power in each scale. So, the lower potencies, that is the 1x, 2x, 3x, means they have less dynamic power and more of the materialistic content, while the 50M, 1M, everything have high dynamic power and less materialistic content. Now, the physician must know when to prescribe a lower dose and when to prescribe a higher dose in each and every case, because just with the selection of right remedy, the case will not be cured. That is, without a proper dose and proper repetition, a case cannot be cured. So, knowledge of repetition of dose. Now, the physician should have a proper knowledge of when to repeat, when not to repeat, and also how many times to be repeated. Because unnecessary repetition can cause an aggravation of the complaints. And also during repetition, the physician should consider the fact that should the potency be changed, that is, if he has been administering 30th potency, should it be changed to 200 or to 1 m. So, this knowledge should also be present while prescribing a dose. The last one is knowledge of obstacles to recovery. Sometimes even after the prescription of a similar remedy, a proper dose and repetition, cure cannot be obtained. Now in these conditions, the physician should have an idea about the obstacles to cure. Obstacles of cure means some things or some factors that prevent the complete recovery or complete cure of the patient. Now the physician must have knowledge about the maintaining causes, miasms, and also any factors in the patient's life that may prevent cure. Now maintaining cause means some factors that are helping the disease to be. These are two examples to identify the obstacles of cure or obstacles to recovery. One is the patient suffering from contact dermatitis of palms continuing to use an allergic soap which will prevent cure. Why? Because this allergic soap is a factor which is producing the contact dermatitis. So unless and until it is removed, the case will not be cured, how much ever similar remedy, similar dose is being given to the patient. Now the second is a patient with allergic rhinitis working in cotton industry without the use of mask. Now in these both conditions, one is cotton industry and second is the allergic soap. These are the maintaining factors in the complaint. So unless and until they are removed, how much ever similar remedy and similar potency, similar repetition is given to the patient, complete cure or recovery is not possible because of these maintaining factors. If the physician possesses all the above stated knowledges, only then he'll understand how to treat a case judiciously and rationally. And if he follows all these criteria, then he can be called a true practitioner of healing art, which is homeopathy. If you have liked the video, please like, share and subscribe.